Ever since I was a little boy, I can only remember two things that I ever wanted to be: professional basketball player. And after high school, I realized that that wasn't going to go very far. So I turned my efforts to dentistry and never looked back.
What first got me interested in dentistry was when I was 14 years old and had my first orthodontic appointment. I was always turning around and watching the procedures that they were doing. So that's when I really decided that dentistry was the career choice I wanted to pursue.
When I was younger, I was always interested in science, things like that. I started shadowing some local dentists in the area and I just fell in love with it. That's been my goal ever since high school, was to get into dental school and become a dentist.
Echo Ridge Dental Clinic has been around for over 30 years, and I have people who will comment, I remember when you used to haul wood. I was 8 years old. My dad used to have a wood-burning fireplace in the waiting room, and I said, yeah, I worked my way up. My mom actually is a hygienist. She temps here still. Patients like to see her because they remember her from many years ago too. What sets Echo Ridge Dental apart is our ability to take care of complex problems and simplify them for patients. We generally will do a free consultation, free second opinion, free implant consult, and we can go over with the patient, what their situation is, and then we can start to formulate a treatment plan. At the end of the day, with whatever we decide to do, I want them to be happy with it, and then they have to be able to afford it. Patients are afraid when they come to the dentist that they're going to get the most expensive treatment plan every time, and they're not really going to have a say. Our goal is to find out what the patient can afford and what their ultimate goal is. Maybe they don't have all the money in the world, and you have to do it in phases, and we try to find something that fits into their life, and then give you the best dentistry we possibly can for that budget. And I think really that's when you start providing value to the patient.
The three of us are always constantly traveling all over the United States, getting updated on various treatments from implant to endodontics or even root canals.
Recently, I became certified in oral conscious sedation. We had to fly out to Washington, D.C. It was a 3-day course all day, so that way we can provide sedation for patients that may be a little more anxious or have fear going to the dentist.
After a couple sessions with sedation, most people realize we're good people, we're going to communicate with you, you're able to communicate with us if you're having any problems. There's really nothing to fear here.
Our office is always trying to stay up to date on modern dental techniques and technologies.
One of the pieces of technology that's pretty new to our office, just over a year old, is 3D imaging for impressions. We're using a scanner that scans the teeth directly, and then we can send a 3D file to our laboratories and they'll fabricate a fixed prosthetic or a crown using that technology.
Our scanner takes thousands of pictures and stitches it together in 3D. That way it can create a crown that fits much better, and it only takes 2 weeks for the crowns to come back from the lab.
The type of crowns that we're utilizing off of those scans are so much more accurate and are so much stronger than what they used to be. Ultimately, that's what patients are looking for. They want something that's going to be in their mouth and is going to have longevity.
Dr. Ray, I can tell you just from my own experience, the level of the cases that he's doing and being able to deliver that in an affordable manner is phenomenal. I haven't seen it anywhere else. And he's been a good mentor for me in that regard.
What I think is remarkable about Dr. Ray is that he can take a very complex treatment plan and make it simplified for the patient in a way that's understandable, and he's really good at describing treatment and treatment options.
Andrew's a very skilled clinician. He has great rapport with patients, very funny, off the cuff. People generally enjoy that humor, especially in the dental office, so it's a good combination to have.
I love you, man.
Thanks.
Dr. Amanda is getting into the practice more recently. Her and I used to practice together for 2 years at another office before we came here. Her role is basically developing relationships with patient, comprehensive care, being able to find problems through diligent exams.
One of her unique skill sets is just putting patients at ease, making them feel comfortable. That's a huge thing when you come to the dentist.
When new patients come in, they may have a lot of dental problems, and we can help them find out how to solve those problems and get to some point of stability that can then be maintained throughout their life.
If you'd like to learn more about our office, visit our website at echoridgedental.com.
Check out our patient reviews from patients who have actually had the procedure done at our office.
Learn about different procedures we offer, as well as our doctor bios if you'd like to learn more about the doctors that work here.